We laid off 10% of our U.S. workforce in July.
We offer great flexibility in regards to the operations. If you need someone to work on your documentation, we have an offsite team member that is ready.
As of July, 16% of all medical suppliers are planning on closing locations. Good day and welcome to the Offsite Team Podcast. Things are absolutely crazy in the DME, the rehab, the respiratory sphere. I swear the government is out to get us. Actually, I think the government has no idea what's going on. They're not out to get us, but things are tough. And we're going to talk about just the current state of reimbursement. And as we record this, going into September of 2024, how we can help other companies really thrive in this crazy workforce that we are currently in. But hey, I am here with April, our president of our offsite team. How are you today, April?
I'm good. I've been busy. How are you?
I've been just as busy as well, too. We slacked a little bit on our podcast, but we only slacked because we were going full force in our actual DME business that we oversee. We oversee a DME business with 5 locations in Central Washington. And things have been just crazy. And we're going to be talking about that today. What's going on in the industry from our perspective? When you go to places like MedTrade or listen to other people talk, it's not typically from the medical supply point of view. So what we offer today is we're going to offer the medical supply point of view, what we see in our stores, what's happening with our customers, and the way out of this. So we all know what was supposed to happen. Let's just go all the way back. If you have not gone, if you've been living under a rock or weren't aware, typically every single January or typically the last week of December, the U.S. government passes an omnibus bill. And what this omnibus bill does is effectively helps fund the current year. Whatever side our listeners are on, it is what it is. But the Republicans and Democrats don't necessarily play well together. Well, this year, they never came to an agreement. And in every area but the rural areas, Medicare reimbursement dropped 25%. So I'm just going to throw out some numbers. If you're getting paid $100 for a widget that we were renting, if it was one of the commonly bid items, it was now $75. And that walloped our bottom line. And our company, we thought that something was going to happen. We thought we could kind of ride things out. And I'm just going to be honest, the company that we oversee, we decided, and this was hard. In the 20 years that I have led Howard's Medical Supply, we have never laid anyone off due to budgetary reasons. We've never done it. And for the very first time, we sat down as an executive team, and we're still doing okay. But we said, if this keeps up, it's going to be better to cut sooner rather than later. And what we ended up doing is we laid off 10% of our U.S. workforce in July. It was not fun. We did it, and we had to do it. Well, we didn't have to do it. We could have strung it out a little bit longer, but it would have been irresponsible of our company if we didn't do it. And this was not fun, unfortunately. And that's so that was one of the things that we did. But I want to get into AA Homecare, and we're going to put this in the show notes. If you want to actually read the full report, you can read it. AA Homecare, which is the association that lobbies for those of us in the DME industry with the government, came out with a survey of durable medical equipment suppliers assessing the impact of the Medicare fee-for-service 75-25 rate cuts for non-bid, non-rural areas. So essentially, because this didn't go into place, that's why our business and frankly, everyone else I've talked to is really hurting right now. And the reason why is they just said, hey, it'd be like going into work and saying, I know you're going to get $20 an hour, but 25% of that is, let's say if you're making $20 an hour, that's now 15. That would never fly in any other industry. But for us, they made us take it. And so that's literally what has happened. And there's been large problems because of that. And so they talked to a lot of suppliers regarding this, and they came out and it basically said because of the rate cuts, 65% of all stores in the United States today, they had reduced the amounts of and or types of products they offer Medicare fee-for-service patients. So this means if you were going to get, oh, let's say a wheeled walker and doing an assignment, you might not do that. It could be wheelchairs. It could be specific kinds of CPAP supplies, CPAPs. They are reducing what they offer. And we all know the reimbursements. There are some items that are very, very profitable, some that are so-so, and some that are just hot garbage. So 65% of all stores are reducing what we are offering our customers. 53%, and we would be one of these, 53% of all stores across the United States, according to the survey, have reduced staff. So we laid off 4.5 people, and we just did it to make ends meet. Next, 45% has reduced their service area. We have done that to a degree. We have some Spidey secrets that we use as a company, and any of our clients, I'll tell you what those Spidey secrets are. So our company has not reduced our service area. In fact, we've actually expanded. But there are some things that we have done, and anyone who's a client, if you're a client of ours, we'll just tell you this is how we do it. And it's really, really effective of cutting costs, because really the cost per delivery is very expensive. Next, as of July, 16% of all medical suppliers are planning on closing locations. We're actually not part of this category, but I do know of other companies that are. And 12% has reduced services to Medicare fee-for-service beneficiaries, and on and on and on. So this is what the key findings came out in this report. And really, any of us in the industry, we already knew this, but it's really nice having numbers. April, from your perspective, were these numbers surprising to you, or were they just a confirmation of what you already knew?
It was actually with the Change Healthcare issue.
Oh, yeah.
So I think part of me was like, I knew it was coming because of that. So they were having issues, and then but I am still surprised when this happened. Although back of my mind, I feel like, oh, this is probably in line with that one, with the Change Healthcare.
Yeah, because Change Healthcare, what Change Healthcare did is it made it faster. We knew it was coming, but all of a sudden, you can typically deal with one or two things going wrong in a business, but it was like one more that broke the needle in the camel's back. And it threw a lot of people over the edge. Now, here's a quote from the report. It says, so this is from the AA Homecare report. It says, I have been in business 31 years, and we love our community and to serve our Medicare population, but sadly, it has come to a breaking point. We are at the point, if reimbursement doesn't increase soon, we will be shutting our doors and leaving 15,000 patients without a provider. There is not a pathway to even break even at this point. I mean, that is what suppliers are saying. Now, I would actually disagree with whoever the supplier is. It's anonymous, of course. Yes, things are hard. And the purpose of this report is to go to our congressmen and women and to say, hey, we need more money. But when I look at this, I'm not as doom and gloom. I see with every problem, I do see an opportunity here. And if anything, I typically spend 1 or 2 days a month out in the communities, marketing, talking to providers. And if anything, me marketing, things have gotten easier for us to expand as a business because the other suppliers that we go to business against, they are contracting. And so if anyone says, oh, the world's falling, that's an opportunity. As long as the world doesn't end. And people will always need us. No one's ever going to not need a wheelchair. No one's ever going to not need home oxygen. It just might not be as profitable as it has been in the past. And so, yes, another quote was, we've cut close to 50 staff to date, with more coming, reducing a couple of locations, outsourcing work for the first time overseas. Well, no wonder, there's your problem. Going deep into the credit line and owner financing. We are not sure what the other side looks like, and we still have a ways to go to right side the business. Our staff is depleted, and we've had to cut in several areas that have impacted our customers. What do you think about that quote, April?
I think about our company, Offsite Team.
Yeah.
I believe that we have enough team members that can cover the number of, the costs. We all know that the costs for an on-site team member versus the off-site team member are different. So when you have an off-site team, yes, there's a lot of advantage by having an off-site team member with you and your company.
Now, typically the cost of an off-site team member is 1/3 the cost of an on-site. So what that means, doesn't take a rocket scientist to figure out, you can get 9 off-site team members for 3 on-site. And you can get way more done. So even though we laid off 10% of our US-based workforce, we have not laid off any of our off-site And if anything, we're looking to hire more because we have clients that are doing the same thing that we're doing, but we have to keep evolving and evolving and evolving. It gets really, really tricky. And a little bit like baseball. In baseball, I was never a baseball player, but I love watching baseball. Typically, as you get older, your speed on your fastball goes down. So if it was 100 miles an hour, then it's 92, then it's 88. And the way old pitchers stay in the game is they just get a little more tricky with their pitches, their changeup, their curveball. And I swear that's what it's like running a business today in the DME industry. It's like, okay, we don't have the reimbursements, but we can do this with deliveries. We can do this by maximizing KPIs and utilizing offsite team members in this way. So we can, if anything, do even better. But it's hard. I'm not saying it's easy. It is really, really hard, which is why we haven't recorded a podcast in over a month, because we've been putting our heads together and we're like, okay, let's evolve again. And we have done that. So when working, the conjunction between, so one of the ways around this, one is doing business more effectively. And we've talked about that, and more efficiently through KPIs, KRAs, how do we market to customers? How do we get customers to pay even more? Non-assignment, there's a lot of different options we have at our disposal. What are some of the ways that on-site US-based team members can work alongside off-site-based team members in the business when we're having this problem?
With the financial crisis that we're having right now with the HME providers, I think we can benefit having an off-site team member. That way our on-site team member can focus on the core activities such as patient care. When they go into our stores, they can also focus on service delivery, while the offsite team, we can work, we're on a different geographic side. So if the patient wants to be contacted on a different hours, probably they're working, they wanted to be contacted outside office hours, we have the offsite team member that can do that. If they wanted to be contacted during weekends, we have the offsite team that can do that. So all the back end can be done by the offsite team members, while our onsite team members go ahead and do take care of the front end.
If someone is struggling to stay in business, you really have to say is where can we allocate resources? Because you only have so much to go around. I think about when my kids, we'd go to the grocery store and we'd get a carton of ice cream. We'd get one, because we don't want our kids to get fat. We'd get one carton of ice cream and we'd all split it up. But when the ice cream's done, it's done. No more ice cream. I mean, as a parent, I would not buy more ice cream until the next special day. It's the same though with money. If we sell a CPAP machine, humidifier, headgear, tubing, filters, you name it, and I'm just going to throw out even numbers. Let's say we get reimbursed $1,000, or I wish, let's say $800. Well, that's $800 that comes in. Now, with that $800, you have to buy the machine somewhere between $300 and $500, depending on how good of deals you have with your suppliers, what you buy.
Yeah.
And then that's $300 left over. You have to pay your employees. Oh, you have a mask in there. I mean, and so it's one of those things, it keeps getting squeezed. And
Correct.
it is impossible, absolutely impossible to do it based on the old form of just having a lot of US-based workers. You cannot do it. Some of it is hiring off-site teams. Other are efficiencies that we've put into place through ordering through the portal. So that way people are ordering without even talking to people. They just go into our portal that we have that's HIPAA compliant. I mean, there's a lot of ways that I would call skinning the raccoon. That how are you going to skin the raccoon to get the end result? And it's really, really difficult because they keep cutting what we can pay. And I can tell you one of the things that we've done, not talking offsite team members, we've shifted even more items to non-assignment. And so, April, why don't you explain to our listeners the difference between assignment and non-assignment?
Assignment is the one that we can bill through the insurance, while the non-assignment is we'll bill through the insurance, but once the payment has been made, we'll refund the patient. So it's out of pocket, basically.
I love non-assignment. If someone comes in to get a hospital bed, they just pay us cash. And I like that because I also get to come up with whatever it is. So, they'll drop $1,200, $1,500 on a hospital bed. We'll still bill it to Medicare once we get the paperwork. You cannot bill it without the paperwork. Once that gets done, and then they're going to get whatever it is. But we get the money up front, and that's an amazing way to go. Now, some people will say, we don't have the money, we're going to wait. Well, that's fine. We'll still chase the documentation. We are not going to deliver the hospital bed until we get this. And a lot of times, as we know, it's urgent. Grandma's coming home from the hospital today at 4 o'clock. Well, it's going to take sometimes 2 to 8 weeks to chase that paperwork. Granted, our offsite team is going to start immediately, but it's not the offsite team that you're waiting on. It's the doctor and the chart notes. And sometimes we need addendums, and other times you need prior authorizations. And then you name it.
Exactly.
You have to jump up and down on your left leg while singing Kumbaya, as well as chewing bubble gum and listening to music at the same time to get that to go through. It's just not going to happen. I love non-assignment. Now, unfortunately, at least in our state, it's a little bit harder with Medicaid patients because our Medicaid does not allow us to do non-assignment. You have to take whatever the Medicaid rates are. A lot of the other third-party plans will not allow for non-assignment, but just we need to all know what the rules are. And the nice thing with our offsite team and the training program that you have developed, you have equipped everyone what all the rules and regs are. So if you call me, whether it's Medicaid, Medicare, a different third-party plan, the offsite team, we have our cheat wiki that basically says they know exactly what's covered. So we're giving out the right information to every single patient.
Correct.
What's been the success rate? When you have to tell someone they can't get their hospital bed today, what have you found the patient does?
Most of them will be asking, of course, why can't they have it, and they need to have it. And what's good about it is we've learned about the question behind the question. So what they're asking
we call it QBQing it.
QBQ, correct. So can we get it now? How much is it going to be? So
and they will.
we offer
They'll
them.
pay.
Yes, correct.
Now, if you do have them pay, you have to have the right documents in order, because if you have that Medicare patient pay today and you don't get the ABN saying this is not going to be covered, or you're choosing this, they can come back at a later date. And we've had that unfortunately happen. That's not a lot. I would say in 20 years, maybe 4 or 5 times. And it was typically one of our team members forgot to get the ABN or wrote the wrong reason on the ABN, and we just have to eat it. We have to offer the refund. But our team, we've instructed them, this is the process, because Medicare is very specific. You must follow all their rules, which drives me nuts. And when I was in high school and college, if I got 19 out of 20 questions, that was a 95% and a 8. In Medicare, if you miss 1 out of 20, they call that fraud. If you continue to bill that, which is just crazy, but that is the world that we live in today. So we need to know what the rules are. The audits have to be in place, you name it. Another one of the things in the report, it said, we've had to turn people away for the fact that equipment and suppliers, their doctor's orders cost our company more than our reimbursements. I agree. We're the same way. They will order, whatever widget, and even if we get it approved, let's say our cost is $100, our reimbursement might be $90. We cannot provide that. It's impossible. So what do? The answer is non-assignment. Is really what it is. There are a couple other reasons I'd be happy to, I don't want to say around that, but essentially, you either have to do that, or you have I would say we have a different line of inventory that is primarily cash-based. And so, for example, one of our scooter companies that we work with is Pride Mobility. And what you would do with that is you're going to get PDAC approved product codes. So a typical scooter would be like a K0800. And what you would do is we would call it, it has not been coded. So what you can do is you just sell it cash. And that way, if they do come back later and say, I want to bill this to my insurance, you're like, unfortunately, that's not a billable item. So that is a way around that as well, too. But then they're going to get nothing billed that way. A couple other things that we do as well, too, is we have a very vibrant rental market. And I've really found that sometimes that works well, too, is someone might not willing to pony up, let's say, a couple $1,000s from the get-go, but we rent a lot of items, because that at least gives them hope about where things are going. And that way we might get 6 months rental out of a scooter or wheelchair or a hospital bed, and then kind of figure out what that looks like. So that's another thing that our suppliers can do. Always be looking for answers. So let's say someone calls you today, April, and say, hey, April, I'd like a hospital bed. Someone's coming home from the hospital today. What can you do for me? What would be your response?
I'm going to have to check and see if we have the documentation that is being required.
In this case, we do not. We do not have, all we have is a simple prescription.
If we do have the prescription and the patient needs a hospital bed upon discharge, what we can do is we can offer you private pay. You can rent the hospital bed.
Private pay with ABN.
With ABN, until such time that we can complete the documentation and build a hospital bed through your insurance.
And that's what would happen, because we'd have to have the ABN that says we cannot bill this to Medicare at this time because we don't have valid chart notes. and that's
Correct.
all we can do. And so they're going to know that they're going to do. We do have to still bill Medicare. I forget the exact modifier, but it's the modifier that basically says we don't have this stuff on file. It's going to get denied. But then when the patient gets the remittance, it's going to say the hospital bed was denied because, in our case, Howard's Medical does not have justified chart notes. And that's what you do. And you give them option. And that way we're not the bad guy. It says we're still going to take care of grandma, or we're going to take care of husband, wife, kid, you name it. But we're still going to offer. And a lot of people will just say, no, what can we do? We are more than happy to chase paperwork for you. And that's the great thing about having the offsite team is we can pay the offsite team pennies on the dollar to chase paperwork. And eventually that will come back. And I'm convinced, the next quote I want to read, this person says, the cost of delivery has increased tremendously as well. We are not able to provide the services to patients, which creates another hardship, especially on the elderly. I agree with that. But I think what some suppliers inadvertently are doing is they're pulling back too far. I do believe this is going to slingshot back into the other opposite direction. So for those that pull back too far, they're at risk because they have to go up. Our reimbursements will go up. If not, our government's even crazier than I already think they are. However, we need to be ready for when that happens. So if we pull back too far, it's too far to ramp it up again. So this is where when we decided, okay, we needed to lay off a few of our workers, we did not lay off our offsite team. We laid off 10% of our US-based workers, and I believe, and this is nothing more than me putting on my prediction hat, I could be wrong, but if I'm right, we'll go back next year and say, Erik said, I think you're going to start seeing an increase April 1st next year, which is really 7 months away. We can make 7 months with this. And actually, we're now, our company, we're not losing any money right now. We're doing quite well because of the efficiencies we have and the benefits of having the offsite team. It's just one of those things. And just reading this report is it's so depressing. It's one of those things you're like, okay, you either ignore it or not, but there are a lot of upsides. So what are some of the things that offsite teams can help offsite team members can help some of our customers with who are struggling financially today?
First is the cost of labor. That's the number one. And then number two is we offer great flexibility in regards to the operations. We can adapt quickly. So if you need someone to work on your documentation, we have an offsite team member that is ready to rock and roll. So,
and it's one of those things, if you hire someone, you have to train them. You work with us, we give you someone already trained. That's the difference. So unlike, they'll have to figure out your company your tribal, the way you guys do business, but they're going to come ready knowing exactly how to bill, what to bill. If it's Brightree, it's going to be plug and go. But even other company, it's really, really simple. Really, really simple. It's just figuring out what that looks like. So the report concluded, it says the 75-25 blended rate increase served as a lifeline for many HME companies. So that's what happened last year. That's why our reimbursements were up last year, and we were rocking last year.
yeah.
It then says, since that relief was not extended in January 2024, HME suppliers have been under immense financial strain, forced to make daily decisions on whether and how they can stay afloat amidst unsustainable reimbursement pressures. These adjustments will cause irrevocable harm for communities across America as businesses and locations shutter, jobs are lost, and access to essential products and services is reduced. Immediate intervention is needed to preserve the HME infrastructure that enables individuals to manage their medical needs in a home-based environment. Now, according to this report, the sky's falling. The world's going to end. Now, granted, this report was written to cause Congress to act. I'm going to say, have no fear. The world's not going to end. People need our product. Now, what is going to happen is we need to figure out how do we get this product covered. And we had a customer come into our store. They said, I need this product now. And I said, okay, we accept credit card. We accept cash. And they walked out with that hospital bed. We made good money on that. And that's why I don't think we're going to need to lay off more than 10% of our workforce. In fact, we've already kind of turned things around and things are looking really, really good. But we cannot do things as is. Now, if they do amp this up, we are either going to, well, that's for another episode. What happens when this is fixed? But in the meantime,
Right.
don't go out of business as long as you don't have to. But we have to change the way we're doing business. For those who don't want to change the way they're doing business, it says in the report, yes, just take more money out of your savings. I didn't want to do that. We chose to change today, and I would say, let's change today. Then if you want to throw more money towards marketing next year, go do it. That's a different way of doing things. Here's more of a cultural question. Like in the Philippines, you don't have Medicare in the Philippines, do you? What do you guys do if someone needs a wheelchair? What do you do?
If we do need a wheelchair, we have to pay for it privately.
And do you?
Yes.
Absolutely.
But I don't need a wheelchair, but if I do need a wheelchair, I'm going to have to pay for it.
You will. And we have a lot of people, we're in Central Washington. We have several people who, they are legal immigrants, but they, in our area, but they don't have health care. They pay cash. They pay cash all the time. They know it's part of what it is. So just because insurance doesn't cover it does not mean we go out of business. We can still go forward. And there is a path forward. So, hey, we are here, April and I, we are here to help you. We have trained team members ready to help your team. We'd love to help you. And I also think not only do we have team members that will help you, when you get those team members, we're going to give you some of our Spidey secrets that are going to really help your customers or help your company get to the next level. So in the meantime, if you're interested, go to offsiteteammember.com. Give us a call, reach out to us. We would absolutely love to help you. And also, as you hire offsite team members, you're also going to help change their family, and they're going to work their tail off to help your business. Because not only are they helping you, you are helping them in their business. So until next week, thank you for listening to the Offsite Team Podcast.